Thank you so much, everyone, for joining us today. We are going to take just a minute to let everyone get in the system, and then we will get started. Thank you for joining us for this installment of the Root Cause Coalition's How-To webinar series. My name is Rachel Carlson, and I am the membership manager here at the Root Cause Coalition. Before we get started, I want to go over a few logistical items for the webinar. Attendees will be in listen-only mode for the duration of the webinar. This webinar is being recorded and will be available to view at rootcausecoalition.org/webinars later this week. Our panelists will be taking audience questions at the end of the session. If you have any questions during the presentation, please type your question into the question pane at the right side of your screen. You can submit questions at any time throughout the presentation. We are so excited to have our esteemed panelists join us to share some best practices in utilizing the recently released Status of Health Equity Report. At this time, I would like to pass it off to Monique Van Blaricom and Barb Peaty from the Root Cause Coalition.
Thank you, Rachel. And echoing Rachel, I want to welcome all of you who have taken time to participate this afternoon. Really excited to share some of the key takeaways from our 2020 Status of Health Equity Report that was released officially 2 weeks ago in Washington, D.C. We had a release at the National Press Club and then also did a Hill briefing, and delighted to have you today as well so we can share this information with you and also share how you can use this information. So Rachel, next slide, please. Just by way of background, for those who may not be as familiar with the coalition, we were established in October of 2015, so we're coming up on our 5-year anniversary, and in that time, we have become a coalition that really reaches from coast to coast with more than 75 members from cross-sector organizations who work toward our mission, which you see up there on the screen, as well as our vision. We are so committed to achieving health equity and really think that one of the ways in which we work so efficiently and one of the things that has made us so successful is being a cross-sector coalition. Healthcare obviously needs to be part of this conversation. So much of what we talk about at the coalition is health outcomes and health and well-being, but healthcare isn't just in the healthcare industry sector. It really is working with social service organizations, faith-based community, the business sector, education, funders, and even our government leaders at all levels, local, state, and federal. So it's important to us that we continue to really forge ahead and enlist cross-sector partners so that we can lift up and then scale and replicate for other communities across the nation best practices that work to achieve health equity. Rachel, next slide, please. So I wanted to talk a little bit today before we get into the actual specifics of the report about what drove us to actually develop this report. And I think that there are probably few who are on the call today and few who you would ask in any arena or sector about our healthcare delivery system needing some work. It's a system that is decades old and was developed at one point in time for a nation that has evolved and changed very rapidly, and while it is an amazing delivery system, it is certainly not sustainable and tenable in the form that it is now for the demanding and growing needs that we face every day. I think we need to look no further than what we've all been dealing with in the last week or so with the COVID-19 outbreak and understand the importance of having a public health model firmly in place, understanding how healthcare needs to be really in lockstep with the social service sector, with the education sector. What are some of the systemic effects that this virus that we're currently battling right now are going to have or is going to have as we continue on in the coming days, weeks, and perhaps even months. And that's really what drove us, not knowing, of course, we'd be in the situation that we are now, but knowing that the model really needs fixing, no more just tinkering around the edges. How do we bring in all the different sectors into meaningful conversations so that we can address social determinants of health equity, or social determinants of health that achieve health equity? There's some stats up here on the screens. We know that we're in poorer health than we have ever been. Almost 20% of adult men and women report fair or poor health status. Nearly 12% of Americans, and that's 40 million Americans, live in poverty, and healthcare costs are rising. We continue to see increase year over year, and this really is just not a sustainable model. It takes more than, again, the model we're working in and then tinkering around the edges. We really need to pull back all the layers, see what communities are doing, see what different organizations are doing to achieve health and well-being, and then lift those practices up and see how we can scale it. We also believe that it's ultimately going to take a real emphasis on policy, because as much as we can lift up excellent examples of what's going on around the country, we're going to have apples to apples programs so that we can achieve the best effects for all. Next slide, please. So ProMedica Health System is one of the co-founders of the Root Cause Coalition, which is why on the second line you're going to see a lot of Ohio statistics. ProMedica is based in Ohio, and they've shared this data, and we think it's a really good slide that points up that life expectancy gaps, depending on your zip code, can really vary quite wildly. In New Orleans, for example, if you live in one ward versus another, your life expectancy could be as different as 25 years, just a few blocks away. You look at the different communities throughout the state of Ohio, it goes from 19 years, 20, 21, 22 years in different communities. Again, you might live in a neighborhood where there is lower income and access is not readily available to the most basic services and needs, and individuals who live in those neighborhoods have a much lower life expectancy than someone who lives a mile, 2 miles down the road. That's not right. We need to really level the playing field, and that's what we mean when we talk about achieving health equity. So next slide. So again, we know our current model of healthcare is not in great shape. We know it is not sustainable. We know it is one of the most pervasive issues on the minds and in the hearts of the American public. We know it has become the issue that is the centerpiece of election year after year, whether it's the midterm, the general election every 4 years, or even local elections. What will happen to my health care? Will I still have access? How can I afford this? We really need to make things happen now, or this crisis will continue to spiral out of control. But knowing all these statistics isn't enough. Next slide, please. We can't just continue to talk about our life expectancy declining, the 34 million Americans who have admitted to knowing someone who died because they couldn't afford medical care. It's also become the #1 cause of bankruptcy among our senior population, and too many individuals are skipping care or prescriptions due to the cost. Next slide, please. We know that 40% of American families have struggled in the last year to meet their basic needs, and we consider basic needs to be food, healthcare, housing, even access to education, utilities. Senior isolation is a huge driver of health and well-being. Again, 1 in 10 seniors in the United States lives below the federal poverty level, and we've got to find a solution. So, next slide, please. As we think about what our current reality is, we know that 20% of the clinical and medical care is really the focus. But if you go to the next slide, our well-being really depends on 80% of what impacts us from a social, economic, and behavioral environment. So we just need to flip the focus. We're not saying we dismiss one side versus the other, but we need to have really a dual approach, if you will, as we go forward. And that's why we decided to focus on the status of health equity report. Again, just being 5 years as an established organization, we were delighted to have the breadth and depth of organizations sign on early and continuously to work toward our mission, and felt very strongly that it was important to lift up the work that so many of our members are doing on local, statewide, and some programs that have even been adopted and replicated nationally. So the intent of this report was to lift up those examples. We interviewed more than 25 organizations. Actually, the exact number is 29 organizations were interviewed for this report. And I'm going to have Monique Van Blaricom, who is our Associate Executive Director, share a little bit about how we drilled down into the report, how we divided the chapters, and what became our focus in each of those chapters. And then at the end of this, we'll also share some ways in which you can download the report and use it in your community, because we have developed a toolkit to make sure that this continues to be a living document that can be shared in your organization as well as throughout the communities in which all of you work. So with that, let me turn it over to Monique and look forward to the discussion later on.
Thank you, Barb. And Rachel, you can head to the next slide, please. So Barb really did a great job of setting up, our current state, and talked about the system that we're currently in and really where that disconnect is. It underscores how much work we have to do, but the good news is there are an incredible amount of organizations from all different sectors across the country that are addressing the social determinants and are making real impacts within their communities. So we wanted to highlight that work. We wanted to understand what is needed to achieve health equity so that we can all get really on the same page and really start getting on that pathway to better care. So that's why we developed our 2020 Status of Health Equity Report. The Status of Health Equity Report examines both the progress as well as the gaps in addressing health disparities and influencing the health and well-being of the communities we're serving. So the report includes research of providers, which I'll go into a few minutes, some of the key findings, but it also includes information from dozens of interviews from organizations across the sectors addressing social determinants of health in their communities. Through these voices and interviews, we were able to identify a framework where leaders and organizations are providing real solutions in social determinants of health, and we were able to really see where we needed to make progress and those gaps. So from the research that we did with the providers and these interviews that we did with the organizations within our membership, we were able to feature 3 actionable strategies to achieve health equity, and that's broken up into 3 chapters of the report. Those 3 are listed on the screen here: scaling innovative solutions to drive new and sustainable model of care that improves health outcomes as it ensures health equity; align communities and advance authentic collaboration to address the root causes of health inequities and engage and learn from communities most affected by inequities and of health and social conditions. So these 3 actionable strategies really make up the bulk of our report. And within them, we highlight replicable examples of organizations who are actively integrating these strategies into their social determinant interventions within their communities. Additionally, at the end of the report, we were able to see, like I said, the gaps in what we still needed to accomplish. And we developed a bold 8-point call to action on the steps we needed to take by 2025 to ensure that we're embedding social determinants into care and reversing the root causes of health inequities. Next slide. So as I mentioned earlier, the report started with research on providers. Great Lakes Marketing Research in Ohio conducted a survey of 200 providers, including primary care physicians, nurse practitioners, and physician's assistants on their attitudes and opinions of their roles as professional caregivers, barriers in engaging in health equity conversations with their patients, and potential motivators in encouraging more involvement in addressing health equity issues with their patients as well. Primary care providers, including physicians, nurse practitioners, and physicians assistants, agree that there is a need to address health disparities, but they feel it would require increased access to resources and more effective integration of clinical and community resources for the primary care provider to feel their involvement will be productive. For example, access to clinical pathways in electronic health records was a very important motivator. The research also showed that there needed to be an increased effort in educating and training providers about health equity and the role healthcare providers play in addressing these issues, how to effectively integrate that role into their current practice as well. This was particularly true of primary care physicians and physicians' assistants. Primary care physicians, nurse practitioners, and physicians' assistants are more divided on who and what organizations should take ownership of health equity in their community. They're more likely to think it's the responsibility of organizations and institutions that are traditionally responsible for health disparities, for example, public health departments, government, social service sector, and are less likely to think it's the responsible of the healthcare professional, whether that be the provider, the hospital, or the health system. We listed some of the additional findings on the screen there, as well as the demographics of those 200 that we surveyed. But what I really want to underscore with this survey, while it was, a small sample size, it did give us a foundation to start digging into the interviews that we did with the 29 organizations that helped develop the actionable strategies and then ultimately our call to action with the report itself. This gave us a really good foundation of the landscape of where healthcare is at and how organizations are interacting with this system and the barriers within it. So from this survey, again, we did the 3 actionable strategies. We have really great examples of how organizations are integrating those actionable strategies in their organizations and in their communities. We have a blog series on the Root Cause Coalition's website where we highlight our members. Some of them are highlighted in this report and the work that they're doing. We will send around a link to download the Status of Health Equity report to you all on this webinar. If you would like to reach out or be connected with any of the individuals or organizations featured in the Status of Health Equity report, please reach out to Barb or myself or anyone at the Root Cause Coalition. We'd be happy to connect you. We really want to make sure we're not reinventing the wheel. Part of the reason for this Status of Health Equity report is to really uplift best practices. A mantra of the coalition is to not reinvent the wheel, and where we can uplift and raise the voices of others that are doing the great work is really important to us. And so I hope that you'll be able to use the findings of this report and some of the examples to learn and implement some of these interventions within your community. Really great examples in there, but like I said, and like Barb underscored, we still have a lot of work to do, and some of the barriers that we're seeing are related, are really based in policy and regulation. So Rachel, can you head to the next slide? Some of these barriers we have to be able to mitigate through policy, and from that, we were able to create this 8-point call to action. And I won't read all of the call to action on this screen right now. Please go ahead and read it. The coalition is developing a really robust advocacy plan that's related to these 8 points. And we're hoping to accomplish them by 2025. It's not something that we can do ourselves, but we're really making a call to all of the organizations that are engaged in social determinants and health equity to work on these issues so that we may move the needle and really start to achieve health equity. So I'll pause there. We have some information on our communication toolkit, but I'm sure Barb has some things to say about the call to action as well.
Yeah, thank you, Monique. And as Monique said, we can't do this alone. We know that there are a lot of organizations that are working in the same direction and feel very strongly that the more consistent we can get in our messaging, the more we can all underscore the need for advocacy, education, and research, all three of those components working together, the better we're all going to be able to make inroads. And as I mentioned at the outset, it's phenomenal that we have so many organizations across the country, both members and those who aren't members of the organization. We know that there are really strong programs going on and being developed around the country. But to be able to show the data, which is really what helps move policy and undergirds the policy for moving forward, we have to be able to consistently compare data from program to program. And so that's why all these different programs that we've highlighted in the report, we encourage you to take a look at. And as Monique said, if you would like to be connected with the individuals and the organizations that are highlighted, we will absolutely do this. But we all need to come to some common ground on how we move forward. A very bold call to action, obviously. We are already heading into the second quarter of 2020, and we want the work that we've outlined to be done by 2025. We believe strongly we can make significant inroads in these goals, but we need to work together to do that. And so from all the materials that Monique outlined that are on our website to the information materials within the Health Equity Report, and what you can bring to the table as well. We'd like to hear from you on what you're doing throughout your community also. And again, not to overplay what we're going on or what we're going through now in the nation with COVID-19, but I think it just really puts a light on why we need to be in sync with what we're doing from both a healthcare standpoint and a public health standpoint and a social services standpoint. So maybe we can talk a little bit about the toolkit, how folks can use that, and then we can open it up for questions, because I'm sure that there are probably different questions for different sections of what we've addressed.
Perfect. Rachel, I want to go to the next slide, please. Thank you. So Barb and I have mentioned this communication toolkit, and in our follow-up email with the link to the Status of Health Equity Report, we'll also include our communication toolkit that we developed. The toolkit is a communication strategy for sharing this report with your key stakeholders. It provides outline for dissemination as well as uses for achieving a sustainable health equity model. So you can use this toolkit as a reference on how to raise awareness about the social determinants of health and what tools and tactics to consider as you craft your messages and action-oriented initiatives. This toolkit can help encourage change within your organization in addressing social determinant and health equity programmatically. So whether that be, for example, embedding social determinants and health equity in your strategic plan. It can help you give key stakeholders a perspective of what many health systems, funders, community-based organizations, businesses are doing to connect clinical care to community care. The toolkit can help you understand different models to use. Understand different models used to develop cost-effective, scalable, and replicable health equity programs. It will help better facilitate programs to ensure effective management, save time and resources. We really wanted to create this communication toolkit to make it easier for you all to disseminate this information, this really rich content. So our toolkit includes press release examples, news stories, sample social media posts. We have a sample PowerPoint that you could present to your board, your community constituents, your community partners. It has notable quotes from the report itself, key findings from the research report as well. We really wanted to make it easy for you guys to copy and paste and insert your organization's information related to your community so you can tailor it, but have the information readily accessible so you can use the status of health equity report as a key tool as you work to implement social determinants of health interventions within your community as an ultimate goal to achieve health equity. We hope that, oh, I'm sorry, go ahead, Barb.
Oh, I'm sorry, I didn't mean to interrupt. I was just going to say, we talk a lot about policy, and in the toolkit, I think it's important to know there are some tools for how we can affect policy with a capital P as well as lowercase p. So policy in your own organization and organizations in your community, because that's as important as making sure we've got public policy that is consistent as well. This really needs to become the mantra of organizations, and to do that, organizations and the leaders need to understand what it is we're asking, what is health equity. So there's explanations of health equity. There is an appendices as to what the different words and vocabulary that probably all of you hear on a daily basis, but have they become, words that are commonly understood by the general public when we're talking about them. So we've really put some thought into the tools that are in the toolkit. If you have suggestions on how we can enhance that, we're very much open to that. But really wanted to stress that policy is both from the private sector as well as public policy.
Rachel, next slide. Barb, do you want to take this?
Yeah. So this really is a summary of what we are here to do, and the fact that the coalition facilitates shared learning. We really aim to lift up the social determinants best practices, share them with all of you. We do a national summit every year. If you go to our website, you can learn more about that. But our 5th annual summit is coming up this October in Kansas City, and usually upwards of 650, 700 people from across the country to learn from and share information with each other on these best practices. And then again, advocating for relevant policy. I think that 8-point call to action, as Monique mentioned, has become the very solid basis for a lot of the work that comes from this point forward. We will be doing an advocacy outreach later this year, specifically in DC, but these 8 points are very important to be addressing at state levels as well. And at our summit last year, we had a panel of mayors from across the United States talking about what on a local level CEOs of cities are doing to ensure health equity is attainable and achievable throughout their cities and towns. So this really it cuts all levels, it cuts across all sectors, and it takes all of us working in the same direction. We welcome your input. We're delighted that you were able to join us today, and we would love to hear some feedback, answer questions. I'll see if Monique has any final thoughts, but I think the best part of this type of conversation is really to make it as two-way as possible. So I'm grateful that we've got this much time left to allow for dialogue and to hear from all of you.
Yeah, thank you so much, Barb. And Rachel, if you want to go to the next slide, it has the coalition's main line as well as our social media handles. Feel free to reach out to us through any of those facets, and someone will be sure to respond. But really appreciate you guys taking the time to hear more about the status of health equity report, and we welcome any questions that you may have. And if you all want to talk offline as well about the status of health equity report or the Root Cause Coalition, please do reach out to us. Rachel, I think we have some questions from our participants.
Yes, so we're going to go into the question and answer portion of our presentation now. If you have a question you'd like to submit to Barb and Monique for them to answer while we're on this call, please take a minute to type out that question in the question pane located on the side of your screen. But to get started, we have one participant who wants to know what are sort of the next steps for the coalition following this report, and what comes next in our work and following up from all this information that we've taken in.
Thank you. So this is Barb. I will start, and then Monique, feel free to jump in. So the 8-point call to action, as we've mentioned a couple times, really gives us, we believe, some good solid direction marching forward from an advocacy perspective. When we established the coalition back in the fall of 2015, we did it on the basis of 3 key areas: education, advocacy, and research. The coalition has consistent regular meetings with our members in those 3 areas, so members are able to join on and participate and share information in all of those areas if they so choose, or choose 1 or 2 that are specifically of interest to them. There's a lot of education and shared learning that goes on throughout the coalition, and it's really building the voice so that we can continue to build the case for social determinants being a part of the healthcare delivery model. We have been working on establishing a national commission that really incorporates addressing the social determinants, takes into consideration how are we training tomorrow's providers? Are they being trained? This goes back to the research that Monique talked about at the beginning of the report. Do providers feel that they have received adequate training? Are they comfortable asking questions? Because obviously if you ask questions and get answers that someone is in need of help, you want to be able to have the resources. So we need to really continue to pull all the different points together and not have them loosely going in different directions, which again underscores that there's a lot of work to do. We by no means think that this report has all the solutions, but it lifts up some really solid practices and programs. It puts some bold steps in front of us that we believe we can collectively rally around, and it gives us a basis, a foundation for when we're talking to our lawmakers or when we're talking to other community leaders, whether they be business or healthcare or social service, how and why, if that organization has not adopted a philosophy and foundation for working and addressing the social determinants of health, why it's so important to do that. Monique, anything to add to that?
No, I think that was a really great explanation of some of the work that we're doing. I think specifically related to the report, just underscoring the advocacy platform that the coalition is working towards to help to develop the big P policy that Barb was talking about earlier in this webinar, how the coalition can help shape federal legislative and legislation and regulation related to social determinants and health equity, and break down those barriers within regulation that hinder cross-sector collaboration, that hinder our ability to achieve health equity, where we've been able to see these gaps from the research findings and those interviews, is really where we're focused on that advocacy piece of the puzzle. Barb talked about our annual national summit a bit. I will do another shameless plug. We have our national summit on the social determinants of health, October 4th through 6th in Kansas City. We will be opening registration for that at the end of this month, so keep an eye out for that. We'll be we will probably be having a lot of conversations, if not one, on the status of health equity report, at least some touch base about where we are on these 8-point call to actions. We've been at the coalition talking about reviewing where we're at annually in these areas and where the status of the country is in these areas, either in a formal report or a subset of a report. So that's something that the coalition is currently thinking about, as well as next steps.
Thanks so much for answering that first question. Similarly, another participant wants to know about how the 8 points in the call to action are going to be measured and tracked.
Great question. And I think that's something we need to do consistently, constantly, and always push those 8 points in front of ourselves, as well as push them in front of lawmakers and work with other organizations to ensure that we're on the same page with them to measure them, because we need measurements to know what our outcomes are. We need to know how far we're getting. There's a lot of work in this space, but we have shared these 8 points with a lot of different organizations. We have shared it fairly widely with members of Congress, and I think the interesting point of these conversations that we've been having is no one disagrees. It's a matter of how do we start to get there. And oftentimes we'll hear, well, it may not be the right time right now. Well, it's never going to be the right time if we let that be the answer. I think it's incumbent on all of us to continue to push these points. We would welcome anyone who's on the call today to share if they're addressing any one or a combination of these points. How do you measure those things? I think there again is a challenge. We can measure them from our perspective. Other organizations are measuring, but we need to have some common reporting and measurement in place as well to show the progress that we're advancing. And that's where it gets back to having consistent programs across the country. Because if I have a program, for example, that addresses food insecurity and I approach it one way, and there's another organization across the country that approaches it a different way, there might be great outcomes from both, but if we can't compare what worked best when we approached it the same way, we really need to get some consistency and scaling on a very, very large level to be able to answer to many of these points in that call to action. Monique, anything to add to that?
Yeah, the other thing I would just add is we utilize the coalitions committees that Barb talked about earlier in this in the question and answer on advocacy, education, and research. We actually utilized them. They're made up of our members, representatives from our member organizations, and they were actually utilized quite a bit in the development of this report. Our research committee helped develop some of the questions that were asked in the research part with the provider survey. And I believe that we plan on discussing some metrics and having conversations around, to Barb's point, consistency in data and metrics as an ongoing conversation related to the health equity report and more broadly in the social determinant intervention space in general, because it's an issue that we highlight in the report itself as well.
Yeah, so there's some macro ways to measure, and then I think that there's some micro ways that we need to make sure that we can take all those, put them together, and move forward. But our members are what make this coalition what it is, and it's the work that they bring, and so we'll continue to engage all of our members as we move forward on these 8 points. Rachel, I'm sorry, I think I interrupted you as you were about to ask another question.
Another participant wants to know what each of your biggest takeaways were from this report and from your experience in creating it and your work in it overall.
I'll go first if that's okay, Barb.
Sure.
So my biggest takeaway, I honestly being so close to this document for about a little over a year, it's something really special to see it go out into the public. But what I'm really excited about is just seeing the transformation over the past 5 years of the coalition, from social determinants being not a topic that was talked a lot about, especially within the healthcare setting, and as it's is related to its importance of being addressed within the healthcare setting. And now to see we have 28 organizations coming from some healthcare institutions, some large nonprofits, some community-based organizations, but all are thinking the same way and are really wanting to come to the table, learn together. And what excites me and the biggest takeaway I see from a report like this is that the hunger is there, if you will, the desire is there for organizations to work together. And if we can align all of the pieces, the policy piece, the data piece, we have the organizations that are ready and willing to partner. I think we have the secret combination to make this work. And being able to highlight organizations that are doing this great work was just really something exciting for me. And I think we're coming up on a precipice of social determinants and health equity, and I'm very excited about it.
Yeah, I think that I would echo Monique, and I would also say that being able to lift up the member organizations and really put a spotlight on the work that they're doing so that others can learn about those specific programs, take them back to their own community. We had some members and non-members alike at our public release of this report, as I mentioned a few weeks ago in DC, and to have someone come up and say, we took some of the work in this community or from this report and have shared it, and just the learning that we've done over the last couple of years, even not even from the report as specifically as the work that has been shared over the last 5 years. We've learned from our partners, we've learned from other members, we've been able to implement programs in our community that have really made a difference. And to be an agent in that is probably the most gratifying thing. Our work is to bring all these voices together and figure out a way to put them back out even more forcefully and lift them up. I am so encouraged by the enthusiasm that our members have had to this report. We intend to update it and do annual reports, not exactly in this same format, but since it's been so well received, clearly we've hit a note that there is a need for this type of information to be out there. And I think that the survey among providers is something that really stands out to me as well. This shows that there is a huge desire to be able to address this area and a huge need that we need to train our providers, be physician, nurse practitioners, advanced practice providers, physician assistants, whatever role they play, there is a willingness, but they have to have the right tools and the confidence that whatever they refer an individual to will be there at the ready to help them with these most basic human needs. And to be able to be a part of that equation and solution, to me, is the most empowering thing, and to be able to pass that on to others is so gratifying. Any other questions, Rachel?
Yeah, one more, I think, that we can focus on, or what are the policy implications of this report?
I think there are several. Let me jump in on that. I think that there are several policy implications. There are several pieces of legislation that have been introduced both from the House and Senate side in Congress. If you are interested and not already on our weekly report that we send out on Monday mornings, please email the address that was on, maybe we can go back to that, Rachel, that was on the screen toward the end of the presentation. We'll certainly get you added to that listserv. But we highlight different pieces of legislation that really need more support, that are starting to track and move a bit in Congress. And I think this report helps bolster the existing pieces of proposed legislation that are in front of lawmakers. And I think it also really has implications for a lot of other areas in education, in how we teach providers tomorrow, in housing, in senior isolation. This isn't just health and human services. We've often said, an individual is not divided by departments of the government. It's not my left arm is taken care of by the Department of Education and my right by Health and Human Services. As human beings, we have a host of very complex needs that are inextricably linked. And so the challenge here with policy is to not just think, okay, here's one piece of legislation that's going to be the be-all and end-all, but how does one policy support and uplift the next? And how do some of the policies or requirements that have been enacted affect positively or negatively the individuals who we are trying to serve? And so it's a real delicate balancing act, because you don't want to move ahead 2 steps and unintentionally move back 5 steps. So it really is making sure that we've got our pulse on how all policy effectively and proactively moves these issues forward. Monique, I don't know if you had anything else you wanted to add to that, but I would just sum it up by saying there are a lot of policy implications in all of this, and it really is a balancing act.
Yep, you got it exactly right.
Great. I just want to take a second to thank our panelists, Barb and Monique, so much for their time today, and thank all of our participants for joining us on the session. This session has been recorded and will be available along with a copy of the slides at rootcausecoalition.org/webinars. It'll be up later this week. Additionally, if you are interested in presenting on a future session like this one, please contact me, Rachel Carlson, at rcarlson@rootcausecoalition.org. Again, thank you so much to our panelists. Thank you for your participation today. If you have any questions, feel free to contact us at the Coalition, and I hope you have a great rest of your week.
Thank you so much, Rachel, and thank you to everybody who attended.
Thanks. Have a great afternoon, everyone.